Hello and welcome back to our hashtag I Feel Like Talking discussion today. This is the third in a three-part series where we are chatting about suicide and self-harm and some of the support that is available along with those topics. I'm delighted to be joined again by my co-host Caitlin from the Young Scot Health Panel and our expert from Children's Mental Health Charity, Becky. So welcome back to both of you.
Thanks to everyone who's been watching parts 1 and 2 for tuning in once again. In this video, we're going to look at how you can provide support to someone you know who's suffering from suicidal thoughts or thoughts of self-harm. A reminder that the topic may be upsetting or triggering to some, however, we will be sharing lots of great information about how you can get support if this is something that affects you.
Okay, so for the last time, you'll be glad to hear, Becky, we're going to be putting you on the spot. We've got more questions yet again that have been submitted by young people around this topic that they wanted to ask. So the first one we've got is, how can you support other people if they tell you that they're not coping well?
Sure. And if I had to give one piece of advice, Dane, it would be giving the permission to talk about what's going on for them. And I would advise that you just ask the person directly. So if you're worried that somebody is feeling suicidal or worried that they're self-harming, ask directly. You're not going to make things any worse, just the opposite, in fact, by asking directly. Sometimes that's what folk need, just to be given the permission to talk about, something that is hidden really and sort of shrouded in quite a lot of shame, and the sense of relief that people can experience just from you asking in that very direct way can be immense for people. So giving permission to talk by asking about it. I think active listening, so just really listening with acceptance and with empathy, with care, so not moving into, asking why or anything like that. So not moving into being judgmental, just really listening and accepting what a person is telling you. I think being really clear though about what you can do and what you can't do. So your limits and what might be the limits of like confidentiality around that. So if somebody is needing some help, that you might need to work a way out together of getting that help, and sort of it connects into that my next point, which would be offering people control over how they want that piece of so if you do need to seek further help, so how you want that sort of story or distress to be communicated and to who. So it might be that the person wants you to accompany them and speak to that person, whether it's like a teacher or GP or a parent together. It might be that they want you to actually tell that story rather than having to retell it themselves, or they might feel that they can do that on their own. So it's offering control about how that information is passed on. It might be that you want to make some time for that person to talk about what's bothering them, either at that moment, or if you need to do something about it there and then, so there's some sort of action that needs to take place, it might be that you decide to do that at like a later stage and just really think about, what it is that's bothering them. And then I think it's information and signposts. And I think the key thing is not feeling like you need to deal with this on your own. So think about, who else you can involve and how you can maybe create like a network around the person of sort of trusted people. So friends, family, professionals, things like that. I suppose the last thing that I want to say, and I know we'll come on to this, is around showing care to yourself. And that's just so important. I think we're going to come on to that in a moment though, but it's just so important because it's really impactful stuff,
Yeah, absolutely. And I know you sort of touched on this in your answer there, Becky, but how should you react to family and friends who are suicidal or who self-harm?
Yeah, I mean, I often get, the visual, and this is from my own professional life, of like a swan on the water, you know, and you can be all serene, and then your legs are paddling underneath. But it's maintaining that sort of swan-like composure outwardly. Anyway, you will be doing that internally, but it's really thinking about how you can be calm and accepting. You know, you may find, particularly if it's somebody who's personally connected with you, that you have strong emotional responses yourself. So obviously there's the emotional, the emotional stuff, the emotions that are coming from the person in distress, but there's also your own emotions in relation to that. So people can feel angry with the person, they can feel guilty for feeling angry, they can feel just sort of really sad or really distressed or really helpless themselves. So it's really trying to stay like outwardly calm, and just being able to hear what somebody is telling you without judgment or shaming the person. Easier said than done, but that's the aim.
Absolutely. I can definitely empathise with that swan. I really like that metaphor, the idea of being calm on the surface while you're paddling away furiously underneath. Yeah, I think that's good advice. Just being there for someone and trying to approach it in that as calm a way as possible in a non-judgmental way. Really great advice. The next question kind of moves on with that in terms of giving that support to other people, and it's, how can you talk to a friend who is having suicidal thoughts or who is self-harming without making it worse? How do you know what to say and what not to say?
I would come back to I think it was the first point that I made. You're not going to make anything worse by asking. So that would be my number one top tip, to ask outright if your friend is feeling suicidal or they are harming themselves. I think it's remembering that you don't have to be the expert. You really don't, you know. And remembering that the reason that the person is telling you this information is because they feel safe with you. I think it's just really listening, as we said before, really accepting what's being brought to you, and then really thinking about how we can key your friend or this person into getting the help and support that they need. So I suppose key things about what not to do is the sort of why question. So it's the judgmental question of why are you doing this, or asking anybody to stop. It's just remembering that, particularly with self-harm, that, you know, it is a coping strategy. So it's being caring, and it's knowing your limits, you know.
Absolutely. And our next question is looking more at kind of in the moment. If you are with someone who has self-harmed there and then, now this might be a difficult one to answer in terms of it may not be an area where you're an expert, but I think providing some information or even just some tips on things that you can actually do in that moment might be helpful to some people. So the question is, are there any simple first aid tips that you can give for treating someone who has just self-harmed?
Yeah, and it is a tricky one, isn't it, Dane? Because like I think we talked about in the first video, the variety of self-harm that there can be. So there can never be like a, you know, like one answer to this question. I suppose I would be thinking about just your normal sort of first aid like responses. So it might be making sure that injuries are clean, you know, in the case of something like scratching or cutting. It might be that you need to apply some pressure, you know, to whatever it is, and like cover it up. It's just your simple sort of first aid responses. It might be that the person needs some comfort, you know, so it might be that they're feeling quite sort of shell-shocked or traumatized at that particular moment. Maybe they need like a warm drink and like a blanket around them. It depends what it is that you're being presented with. But what I would really stress is that if it's beyond sort of like simple like first aid responses, you really need to be seeking, you know, medical help, and that would just be the same as you would do in like any other situation, wouldn't it? Like with an injury. So I don't think that self-harm should be any different in that regard, you know. Does that make sense?
Yeah, no, definitely. I think there's lots of great information there, and just keeping it simple and doing what you can in the moment.
Yeah, absolutely. Like those are really clear instructions. And I think we're going to move on now a little bit from talking about helping other people to how to look after yourself.
Mm-hmm.
So how could someone go about getting support for themselves if they were helping someone else with thoughts of self-harm or suicide?
Yeah, and it's a really important one. And I suppose I always, you know, I'm full of metaphors in this video, it looks like, but as well as my swan metaphor, I often think about the oxygen mask metaphor, which is, you know, you need to fit your own oxygen mask first to be of any use to anybody else. So, and it's just bearing in mind that this is, you know, it's really impactful stuff, and people can suffer from things, and I won't go into them on this video, but it's there, you know, on the internet using the signposting that we've talked about. But people can suffer from secondary traumatization and vicarious trauma as well, as a result of trying to support somebody who's really distressed, and that can be both sort of mentally and it can be felt physically as well. So it's really important to show care to ourselves. And I would just say that, you know, the agencies that we've listed, you know, to support people who are self-harming are also there to support others, and would be there to support you in that scenario as well. So your GP, there's the Samaritans, and all of those resources that we've listed. I would also say that it's just really important to practice self-care, and that might again look different for everybody, but it's really thinking about what you need to do to look after yourself. And one really good thing to do in response to somebody who is self-harming or experiencing, you know, suicidal thoughts is to try and create or help the person who's exhibiting this behavior to create a network of support around themselves. So this could be other friends, it could be family, it could be other professionals, just so that if you feel that you need to take a break, or actually if you get to the point where you think, you know, I can't support with this anymore, that you'll be able to do so, you know.
100%. I think it must be easy in a situation like that where you're trying to help someone who's very close to you to look beyond your own mental health and well-being, and that can become an afterthought to you. So yeah, some great advice is always there, making sure that you've got that network around you, or that you do seek out those organisations that we've mentioned in previous videos that are there to support you as well. Always remember that your mental health and your well-being is important too, and that you need to look after that. But yeah, that brings us to the end of these questions. Amazing advice that you've given us there, Becky, as always. And with that, that's the end of our 3-part series. So parts 1 and 2, we covered a little bit about suicide and self-harm and how you can get support for yourself. In this video, hopefully we've given you some good information on how you can give support to other people who are experiencing any of the topics that we've covered in these videos. So thank you all very much for watching. A reminder that all of these organisations are there available for you to talk to reach out to if you need any extra information, advice, support with any of this. At Young Scot, our I Feel campaign has lots of good information as well, lots of articles where you can get advice, you can get information in them, and there's also resources on that site that signposts you to different organisations where you can get other support. So you can find that at young.scot/I feel, and that's AYE feel. So head over there if you do need any more information, advice, support with any of the topics that we've discussed, or anything else to do with mental health and well-being.
As Dane said, remember to check out parts 1 and 2 if you haven't seen them already. There's lots of useful information on how you can get support if you're struggling with any of these issues we've discussed, and there's also some great information about what suicide and self-harm actually mean. So thanks again to everybody, and goodbye.